invite you to discuss this issue with us. 52 years old female came to our clinic. She had no complaints, but she was referred to vitreoretinal surgeon. The patient has high myopia with a good visual acuity 1.0 with myopic correction, and the examination revealed the retinal detachment in the inferior half of the eye, extending from the peripheral retina to temporal vascular arcade. And with the detachment was with a well-defined border and clear subretinal fluid. And that's why we decide that the detachment began from the myopic retinoschisis. And we began to treat. We made pars plana vitrectomy with silicone oil tamponade and peripheral laser photocoagulation. However, a few days we found that the detachment had not fully reattached, and but the area decreased, and we decided to perform the additional laser photocoagulation in 2 sessions. And after the second session, the patient report about violet central scotoma, similar to those occasionally observed after such intervention. And we anticipate that this symptom would resolve the next day, but it persists at the 1 day, 1 week, and 1 month follow-ups. Every follow-ups, we performed OCT imaging and perimetry, and we didn't find no structure change on OCT pictures, and no layer atrophy or signs of ischemia. But every time we found the central scotoma on perimetry. We found several articles describing the similar cases, and they classificate such a photosensory maculopathy caused prolonged light exposure, and in all describing cases, these symptoms resolve spontaneously without any treatment within from 1 to 6 months. And that's why we decide to wait, and the OCT findings remained unchanged over 6 months, but the patient's symptoms persist. She continued to see a central violet scotoma, which she described as a flashlight glare. The scotoma didn't increase in size, and we decided that the silicone oil might be the reason of this, and we decided to remove it. But after removing, there wasn't an effect. And we have been following this patient for about 18 months. She still has a localized peripheral retinal detachment, but it has remained stable and unchanged a long time, and she still see the central violet scotoma. And here is her current OCT and perimetry imaging. And we would like to discuss the following question. Has anyone encountered a similar phenomenon? Could this be related to the vitrectomy or to laser light exposure? We have ruled out direct laser injury, as we used a laser system with navigation, and we have also ruled out ischemia. There is no characteristic OCT signs, and nothing changed in 18th month, and scotoma is very small, like a dot shape. And thank you for your attention and insights. Macula on.
Yeah, I don't know. I think the annoying thing, it was a macula on, but it was just macula on, right? Was just the macula was
Yes,
just on.
Macula.
I mean, to be honest, I'm sure we see these symptoms, but in the big scheme of things, we just don't take good notice of them, or we don't focus much on the patient's symptom. I really don't know. I mean, I think I would just tell the patient, just get on with it, and not much we can do. But why this happened, I really don't know. I mean, I think one of the things, I mean, this is a complex case, so sometimes you may need to use oil in these cases, but it might be best to avoid oil in general in patients who are macula on or have good visual potential, because you see a lot of issues with oil and also oil removal. I'm not sure that this is the case here.
Yes, but it is not about the way of treatment of this patient. If it was now, I would never go this way. And but maybe I tried to sclerobuckle use, and but I talk about these specific symptoms, and we thought that it might be resolved for a few days after the laser coagulation, photocoagulation, but it's still about a long time, and we didn't find in any articles about such cases, and that's why we decided to talk about it. Maybe it's the first.
What was the visual acuity pre-op and post-op?
Pre-operation, sorry. Pre-operation, it was a good acuity, 1.0, with a myopic correction, -6.
And post-op?
Post-op, it's she has a central scotoma, and we couldn't observe it, and she counted the fingers from 50 centimeters.
Yeah, it's very interesting. You focus on the symptom, okay, but it is pretty much known. In 5% of the patient with silicone oil, when you remove, they have unexplained visual loss. You cannot explain. And I myself have experienced that people with 0.7 with the oil in, and you remove the oil, become 0.1. You do all kind of angiography, everything, you don't find any. But in your case, because of the symptom, it may raise a question. That question is the symptom which is happening some kind of neuronal changes happening? That's why she was complaining. And then with progressive neuronal change, the vision didn't improve at all. That's why angiography will not show anything, because it's not vascular. And you cannot detect. It's a very important symptom. We started the process. That's why also we have shown before that how silicone oil is so much inflammatory. So most of the time we use gas as much as possible. With macula on, we prefer gas. So that should be the point. Yeah. So that's how we learn. So silicone oil, it still causes inflammation. And yes, it causes. So we use less and less. Okay.
Yes.
So it's and even it causes breast implants.
Yes, thank you very much. But,
Yeah,
these
but
symptoms,
your symptom, what you describe, is important in understanding the neuronal changes which happens. We won't be detected with anything unless you do some kind of electrophysiologic changes. Okay, thank you very much.
Thank you very much.
May I request Dr. Kavita, ex-Dubai resident, now in UK,